So this is a very interesting case. I started off in 2003. I'm Dr. Deepak Nakra, and Mr. Kartpal is a very old patient, one of my very first implant patients. I placed one implant in 2003. He has been coming to me since then, just regular follow-ups, but 17 years later, he has nothing except just one implant in his mouth. Now he's 50 years old, he's diabetic, he's got a lot of other things going on. But I don't want to tell a man that he cannot live a good life because I can't give him teeth. I don't want him to end up eating soft food and starting to feel like an old man. So I decided to go ahead. I have a fixed plan what I want. I know exactly what I want and I will do only that. I did not give him options on treatment. Some people thought it was not the best thing to do, but I knew we'll do the right thing. Now, 17 implants and 28 teeth later, he's a happy man. And my aim of ethical dentistry is still going strong. And the trust I've built up over the last 20 years with my patients is priceless. So this is one case which is ideal for that.
My name is Dinesh Kartpal, and I have a showroom in Rajouri Garden by the name of Samay. I came to know about Deepak Nakra from an advertisement and a board where I parked my car, and the board was there, Dental World, and then I went to the clinic because I was having some dental issues and pains and things like that, and it's been almost 4 years that I'd been going to him. All sort of unhygienic related teeth and pains, and when I showed Dr. Deepak, he said some extractions had to be done, some implants had to be done, and a lot of complications and all that were there. Then we started on with first stage saying that a few teeth had to be extracted and some implants had to be done and all that. We got it started and then we planned to go ahead with our treatment, and then he said, I think it will be better if you take out all the teeth and we have an implant and all that. I was very skeptical about it. I said, I don't want all my teeth to go. But he said, 50% have already gone and 50% will be there. Again, you'll have to implant them after 2 years, 3 years or something like that. But after all this, the implants were made and the teeth were put in thing. It was a very long process, in the sense I had to go for a lot of things. I was not as sincere with my dates and things like that. I was traveling and off and on. Things were not good, but now that we have done the implants and all the teeth have been put, now I'm able to eat well, being able to do whatever I used to do before. I think I don't feel the difference like after the implants and before the implants now, to be very frank. And I'm eating what I used to eat earlier. I don't have pain, I don't have any issues right now. I had a latest checkup with the doctor and I said I'm just having a bit of the speaking problem and a bit of slurring and a bit of the adjusting of the tooth and all that. He said he just wanted to see the implants have been set and all. He said this can be done and just that slight process is left. Otherwise, I think this is the best thing that could have ever happened to a person with implants. People are skeptical. I hear that the implants are not successful, people aren't being able to eat and things like that. But I think this is not true. As to my experience, and a very genuine experience, I am really doing things as I want to do with my teeth. It's not that I'm stopping myself from eating anything, except that doctors asked me to maintain my sugar levels because those are necessary even if I have the implants. It was a very difficult task for both of us, but finally we made it and we are through it and I'm doing well. Well, I'd like to thank Deepak Nakra and his whole team. It was a good effort by the end of the day and I'm again thankful to all of them. Thank you.